Critical colon cancer symptoms you should never
Today we're
ignore.
digging into something pretty important.
Why are
A
cancer
shift in
rates,
public health
particularly
that
for
really
colon
touches a
cancer,
lot of
rising?
lives.
And not just among the older
surprising
population,
rise of colon
but increasingly in younger
cancer, and
people as
especially
well.
among younger people, which is quite
Today, let's
alarming.
explore this
really is.
concerning
This
trend
isn't
and
just about
provoke
stats,
a meaningful
though.
debate.
We want to understand what's really
Make sure to
driving this
watch until
trend
the end because
and
there's
what
a
it means
list
for
of
your
the
health.
most common colon
might be asking
cancer
yourself,
symptoms that
why
you
are
might be
cancer rates,
experiencing.
especially colon cancer,
Colon
going up?
cancer ranks
And not
as
just
one
in
of the
older
most
folks, but younger
devastating
people, too.
diseases
It's a
today.
huge question, and colon cancer,
It is the
well, it's a
third most
heavyweight.
commonly
It's the third
diagnosed
most
and the
common
second most
cancer
fatal type of
diagnosed, and
cancer.
really
But what makes the
tragically,
fight
second
against this
most fatal.
disease even
Wow.
more
Yeah.
complex
And
is the
what makes it
formidable
even
industry
tougher
that
to
has been built
navigate is
around
just
it.
the sheer amount of information
An
and
industry driven
misinformation
by money,
out there.
misleading
This huge
ads,
industry
and
around
so
it,
much
often
confusing
driven by money,
information that it leaves both
Misleading
patients and
ads,
healthcare
confusing data.
professionals puzzled
It
and
leaves
often
everyone,
wrong.
patients and doctors alike,
A
kind of
common
puzzled,
misconception
often
is
getting
that
it
your
wrong.
risk
Okay,
for
so that's
colon
what we're doing. Our
cancer
mission
is
today is to cut through
primarily
all that
determined
noise,
by your genetics.
get to the core insights. Let's start
While
with
it's
the big
true
one.
that having a
common
family
idea is
history
that
can
your risk
increase
for
your
colon
risk,
cancer
accounting
is
for 5 to
mostly,
10% of cases.
genetic.
This is
Down to
far
your
from the
family
complete
history.
picture.
Right. People hear cancer and immediately
Genes may load the
think
gun,
genes.
but it's our
Exactly.
lifestyle
And
choices
yeah,
that pull
sure,
the trigger.
Having a family history does increase your risk.
In this
It
context,
accounts for
modern
maybe,
research
what,
is
5 to
increasingly
10% of
highlighting the
cases.
impact
Something
of
like that,
diet
yeah.
and
It's a
lifestyle
factor,
as key
but
factors in
nowhere near the whole
preventing
picture.
or even
I
reversing
love
the
how our
disease.
sources put it.
Foods rich in
Genes may load the
antioxidants,
gun,
for instance,
but it's
are
our
now being
lifestyle
acknowledged
choices
for their
that pull
role
the
in
trigger.
fighting
That's a
various
perfect
chronic
way to phrase
conditions.
it, because modern
This isn't
research
mere
is really pointing
speculation.
strongly
It's
towards
a
diet and
fast-growing area of
lifestyle.
scientific
These are key
research that
factors
shows
in
where
prevention,
medicine
and
is headed
sometimes,
in the
even
future.
helping reverse the disease.
That's fascinating.
How to know
It
if you
is.
have colon
and what's
cancer.
really groundbreaking now is understanding how it works.
What are the early
specific
symptoms of colon
compounds in
cancer?
food, those rich in antioxidants.
What symptoms
They
indicate
don't just
advanced
fight
stages of the
disease in some
disease?
vague
How can
way,
you
they
detect it
actually,
early?
Modulate gene expression.
What
So
exactly
they're
is a
changing how our genes
colonoscopy,
behave.
and who should
Basically,
consider
yes.
having
kind
one?
of reprogramming cells to be
What
more
are
resistant
intestinal
to chronic
polyps,
conditions.
and how can they be
Pretty
prevented from
So this
turning
isn't
into
just,
cancer?
like guesswork.
Most importantly,
It's a
are there
real
natural ways to
fast-growing area
prevent
of
and
science.
combat this
Shows where
condition?
medicine is heading, doesn't
Contrary to what
Absolutely.
many
It's the future,
believe,
I think.
this type of
And
cancer
knowing
often
this,
eludes detection for a
Well, it
long
gives
time,
you,
sometimes
the
years.
listener, a lot of power.
It typically starts
Knowing
as a
your
small,
daily choices
slowly growing
actually
polyp
matter
on our
a lot.
intestinal wall.
Huge power. So
Initially,
if
it
our choices are
occupies
pulling the
minimal
trigger,
space
how
and doesn't
does this
interfere with the
disease,
intestine's contents,
typically start
which is why it
inside
doesn't
us?
produce
question.
symptoms in the early
Well,
stages.
colon cancer is sneaky. It
Therefore,
often,
those at higher risk,
avoids
especially
detection for a
individuals
long time,
over
sometimes
45 or
years.
50,
Years? Wow.
Yeah.
are advised
It
to
usually
undergo a
starts as just a
colonoscopy.
small polyp, a little growth on the
The recommendation
intestinal wall.
comes
They
even
grow
earlier
slowly.
if you have first-degree
Not
relatives who
usually,
have
no,
had
not at
cancer.
first, because they're small.
With
they
a
don't really interfere
colonoscopy,
with,
you can visualize,
passing through the
detect,
intestine. They're
and remove
asymptomatic.
polyps.
Okay, so these polyps
The
are
appearance
the
of
silent
symptoms
starter.
often depends
What's our
on both
best
the
weapon
size
then?
and
How do we catch
location of
them
the
early
tumor.
before they become
Interestingly,
dangerous?
colon
The key
cancer
tool
growing
here
on
is
the
the
right
colonoscopy.
side of the intestine
It's
can
a
be more
procedure,
elusive.
Probably familiar to some
This is
listeners,
because the
where a
feces are still
long,
liquid at this
flexible
stage.
tube with a tiny
The intestine
camera
hasn't
goes into
absorbed
the
all the
intestine.
passing water
Right,
yet.
lets the doctor see inside.
As a result,
Exactly.
it's
To
difficult for a tumor
visualize,
to
detect,
obstruct the
and
intestine at this
crucially
point
remove those
unless it
polyps
is
right
very
down there.
advanced or has
So it's detection
metastasized
and
to other
prevention.
organs,
Precisely.
like the liver,
And for
bones,
comfort,
or lungs.
It's done under sedation
Let
or
me
maybe
offer a
mild
tip for
anesthesia.
early detection.
So most patients, they don't feel any pain.
Tumors
don't
often
even
grow in
remember
a
it after.
disorganized
That's
way,
good to know.
causing them
So
to
who
bleed.
needs one
The
and
issue
when?
is that
Well,
this
the
bleeding
general
is not
recommendation
visible.
now is to start around age 45
One
or 50.
early detection
45,
method
okay.
involves
But maybe even
analyzing
earlier
stool
if you have
samples for
close
hidden blood.
relatives, like parents or siblings
A
who
stool
had
sample
colon
is
cancer.
taken and
Makes
sent
sense.
to a lab
And how
for
often?
analysis.
Typically every 10 years after that, assuming everything looks
Colonoscopies
clear.
are also
But your doctor
effective
will
for early
advise based on
detection,
what they find,
but
of
watch
course.
for these warning
and it's very
signs.
safe. Risks are minimal.
Chronic bleeding
like
can
maybe
result in
some
iron
bleeding or an
deficiency
injury
anemia.
to the intestinal wall, but that's really
If you're
rare.
around
Like 1 or
45
2
or
people out
50
of
years
every
old and
1,000.
look paler than usual,
Okay, so
coupled with
colonoscopy
iron
is key
deficiency
for early
anemia,
detection.
you should be
But what if it's
evaluated
past
for an
that
intestinal
stage?
tumor.
What if symptoms do start appearing?
Sometimes,
Right. When
stool
symptoms
may
show
appear
up, it
darker
often
due
depends
to
on the
slightly
tumor
more
size.
intense bleeding.
And really importantly, its
Now let's consider
location in the
colon
colon.
cancer that
Location
occurs on the
matters.
left
How
side of
so?
the
Well,
intestine.
interestingly, cancer on the right side
Obstructions
of
or
the colon can
intestinal
be,
occlusions
more
happen earlier
elusive,
here
harder to
because
detect
the feces
based on
are already
symptoms alone.
solid.
Why is that?
There's less water
Because
compared to the right side.
intestinal contents, the feces
So what
are still
symptoms
pretty
might a
liquid in
person
that part of the
experience?
bowel.
Uh,
So it's harder for a tumor to actually cause a blockage unless it gets really advanced or, spreads to other organs, liver, bones, lungs.
so what are the clues for right-sided cancer then?
A really
Before we
key
further
tip is
explore the
checking
following
stool
colon
samples
cancer
for hidden
symptoms,
blood. You can't
don't
see it,
forget
but
to
it's there.
subscribe to our
Cold blood,
channel
they
and
call it.
activate
Exactly.
notifications
And if
to
there's
stay
chronic,
updated
slow
with our
bleeding over
informative
time,
videos.
It can lead to iron
One
deficiency
common
and
symptom
anemia.
is a
Right,
change in
losing
bowel
iron in the
habits.
blood.
Precisely.
Suppose
So
your
here's a
normal
clinical
routine
pearl. If
involves
you're
going
around,
to the
say,
bathroom daily
45 or 50,
or once
maybe
every
looking
2 or
paler
3
than
days.
usual, feeling tired, and tests show iron
If you find
deficiency
yourself
anemia.
becoming more constipated
Well,
recently,
absolutely need to be
not
checked
having
for any
bowel
test
movements
work
for
done.
1 or
Good
2
tip.
weeks, this
Anything
should
else?
raise suspicion.
Sometimes the stool might
In
just
other
look
instances,
darker
the
than
shape of the
usual, maybe
fecal
from
matter may
slightly more
change.
intense bleeding,
It
but
might
often
become
it's that
thinner
hidden
as it
blood and the
passes through
resulting
this
anemia
area
that's
of the
main
intestine.
clue.
Okay, so
Alternatively, you
Subtle,
could experience
often detected
episodes
via
of diarrhea
hidden blood or
alternating with
anemia.
periods of constipation.
what about the left side, where things
Many
are
people experience chronic diarrhea,
more solid?
prompting
different story
doctors
on
to
the left
consider
side.
performing a
Because the feces are
colonoscopy
solid
to
there,
check for the presence of an
obstructions or,
intestinal tumor.
Intestinal occlusions.
When the
they tend to
tumor
happen
grows to an
earlier.
advanced
So the symptoms
stage,
would
it
be more
produces an
obvious.
image on an X-ray
A really
resembling
common
a
one is a
bitten apple.
noticeable change in bowel habits.
Oh, so
Like, maybe
Specifically,
you're usually
this
regular,
image
going
shows the
every day or
narrowing
two,
of the
then
intestinal
suddenly
lumen
you
due
find
to the
yourself
tumor.
getting really
As
constipated,
a
maybe
result,
not going for a
feces
week or
have
2 weeks,
difficulty
that's a red
passing
flag.
through this narrowed
Or
section,
sometimes
and the tumor
shape
can also
of the
cause
stool
bleeding.
itself changes. It might become really
Unlike
thin,
the
like a
hidden
pencil,
bleeding in
as it
earlier
squeezes
stages,
past that
the
narrowed
blood here
area
is often
caused by the
bright red
tumor.
and visible.
Interesting.
Another pattern
The
could
stool
be
may also
weird
appear
episodes of
darker due to
diarrhea
the presence of
alternating with
blood,
periods of
similar to
constipation.
right-sided
Just
colon.
Things aren't normal.
Right, just a disruption of your usual pattern.
Exactly. And if the tumor gets quite advanced, it can even create a specific look on an X-ray. They call it an apple core sign, showing how the inside passage, the lumen, is narrowed.
Huh. And what about bleeding on the left
Cancer.
side? Still hidden.
Other
Less
symptoms
often. Because
indicative
it's
of more
further
advanced
down,
cancer
the blood is
include
often
abdominal
brighter
pain
red
from
and actually
obstruction-induced
visible in the
gas
stool.
buildup,
Though
abdominal
the
swelling,
stool
weight
might also
loss,
just appear
fatigue, and
darker
chronic
sometimes,
tiredness.
like on the right side.
Got it.
Symptoms could also
visible
manifest
changes
in internal
habits,
organs,
stool
such as
shape,
liver
maybe
pain from
visible blood.
metastasis or
What about
shortness
other
of breath
signs,
if the
maybe
lungs
if
are
things
affected.
more advanced?
Yeah.
That's why the
other
next
indicators
information
often
on
of
how
more
to
advanced
detect this
cancer
condition
could
early,
be things
and most
like,
importantly, how to prevent it
abdominal
naturally
pain,
is crucial.
especially that cramping pain from gas building
What
up
are
behind a
intestinal
blockage.
polyps?
Okay.
Abdominal swelling or bloating.
These are
unexplained
generally
weight
benign
loss,
small
just feeling
tumors
really
that hang like
fatigued,
appendages from the
chronic
wall of our
tiredness.
intestine
Those
and are
all
typically
potential signs.
asymptomatic.
And if it spreads, metastasis.
The most effective
Then
way
you
to
might get
detect them is
symptoms
through a
related to where it
colonoscopy.
spread, like
This
pain in the
procedure
liver
allows
area
us
if
not
it's gone
only
there,
to
or maybe
visualize
shortness
the
of breath
polyp,
if it's
but also
affecting
to
the lungs.
remove
Okay,
it
that
and send
paints a
it for
clear
lab
picture of the
analysis
symptoms. Let's go
to
back to those
determine if
polyps
it's
for a
benign or
second.
malignant.
You said they can turn into cancer.
However,
right.
there's a catch.
Only a small
A
percentage
small
of these
percentage
benign
of these
polyps
benign
do,
polyps
but
can
they
transform into
over
cancer
time.
over
And this
time.
really brings us back to that core
This is where we
message.
get to the
Lifestyle
core
again.
message of this
Yes.
video.
That transformation
What
it seems
factors
to be
influence
heavily
this
influenced
transformation?
by that mix our genes, yes,
As
but also
mentioned
our
at the
lifestyle
beginning,
habits.
it's a combination of
And the
our
crucial thing we're
genetic
learning is that
makeup
our genes
and our
aren't some
lifestyle
fixed
habits.
destiny. We used to think that.
Contrary to
but not anymore.
previous
So our
beliefs,
genes
our
aren't
genes
set
are
in
not
stone.
set in stone.
What does that mean for what we can control? What's actually
The best way
fueling
to
that
prevent
fire?
intestinal
Turning a
cancer.
benign polyp into cancer.
Current
what
research
accelerates it?
suggests
Well, there's
that
a
our
growing list
dietary
of
choices,
factors.
from the selection
Definitely
of food at the
ultra-processed
supermarket
foods.
to its
Lots of
preparation,
studies now
play a
point to them
critical
being
role in our health.
carcinogenic.
Things like packaged snacks,
A balanced
sugary
diet,
drinks,
along with other healthy
processed
lifestyle
meats.
habits,
Exactly. And
can
speaking of
actually
processed meats,
influence
excessive
gene
red meat in
expression.
general, but especially the really
Specifically,
processed stuff like
genes
sausages,
associated
salami,
with
ham,
chronic
those
inflammation,
are implicated.
dementia,
Bad fats.
obesity,
Think
heart
excessive
attacks, and
vegetable
cancer
oils,
can
things like
become
corn
less
oil,
active when we
soybean
make
oil,
healthier
though
choices.
Olive oil and a few others seem to be exceptions, actually.
On the other hand,
beneficial.
Good to
poor
know.
dietary
Also, too much
choices and
sugar,
unhealthy
excessive
habits
sodium,
can
these
accelerate
are
the
known
activity of
contributors.
these same
And other
genes.
things may be less obvious.
In
Chronic
simple terms,
constipation isn't
this
good.
could speed up the growth of
Having
a
an unhealthy
polyp
gut
and its
microbiome,
eventual
that
transformation
flora we
into a
talked
tumor
about.
over
Right, the
time.
gut health connection.
Huge connection. And just chronic
Risk factors
inflammation
for
throughout
colon
the body.
cancer.
Plus, of course, the habits we know are generally
What
bad for us.
accelerates the transformation of a
consumption and
polyp into
smoking are
cancer?
Definitely known carcinogens, too.
Wow,
Several
that's
factors
quite a list of
contribute to this,
accelerators.
such as
It almost sounds like,
ultra-processed
your grandmother
foods,
telling you to eat
excessive
your
red
veggies
meats,
was
especially
basically
those more
giving
processed
you
like
cutting-edge
sausages,
anti-cancer
salami,
advice.
ham,
Well, slightly,
bad fats,
pretty much,
excessive
yeah.
vegetable
Turns out
oils
Grandma
except
was
olive
right.
oil,
So,
and a few others.
knowing all that,
Sugar,
Yeah.
excessive
the
sodium.
accelerators,
These products,
What's the
or the
flip side?
combination
What
of
can
them,
we
mainly when they come
proactively
from
do? The
ultra-processed
good news
foods,
part.
are like adding
the
fuel to
prevention
the
side.
fire
This is
for
where it
tumor
gets
growth.
empowering. To really lower your risk,
Ultra-processed
the advice is
foods have been officially
maintain a
declared as
diet that's rich
carcinogenic
in
for some time now.
anti-inflammatory and
Other
antioxidant
contributing
foods.
So lots of
factors
colors on
include
the plate.
constipation,
Exactly. Fruits and
poor or
vegetables, a
inadequate
variety of
intestinal
colors every
flora,
single day, like
microbiota,
rainbows. Spices are
and
great too.
chronic
Think Turmeric,
inflammation.
fantastic anti-inflammatory and antioxidant
Furthermore,
properties.
habits like alcohol
What about
consumption
fats?
and smoking are
Healthy
also
fats
known
have
to be
crucial
carcinogenic.
omega-3 Omega-3s, you find those in fatty fish like
Foods
salmon,
and
tuna,
habits to prevent
sardines,
colon
anchovies,
cancer.
or plant sources
To
like
reduce
chia
the risk of
seeds,
colon
flax seeds,
cancer,
sesame
it is
seeds,
advisable to
avocados are
maintain a
wonderful.
diet
Eggs, too,
rich in
especially
anti-inflammatory
free-range
and
You mentioned
antioxidant
constipation
foods.
earlier.
Right.
This
Tackling that
includes
is
fruits and
important. Simple
vegetables in
things.
various colors,
Making sure you're
consumed
drinking enough
daily.
water and getting enough fiber.
Spices
that
like
helps keep
turmeric
things moving
also
and
offer
feeds your
excellent
good gut
anti-inflammatory
bacteria,
and
improving that
antioxidant
intestinal
benefits.
flora.
Makes sense.
Healthy fats,
Any other
such as
lifestyle tips?
omega-3s found in fish
Definitely.
like
Don't
salmon,
overlook the other
tuna,
pillars of
sardines,
health. Things
and
like,
anchovies,
sleeping well,
or
getting
in
regular
planty sources
exercise.
like chia,
And even
flaxseed,
increasing your social
and sesame
connections, believe it or not,
are also
that has
recommended.
antioxidant and anti-inflammatory
Avocados and eggs from free-range
Social
chickens
connection.
are other
Yeah,
good
it's
sources
quite
of healthy
fascinating
fats.
how interconnected it all is.
Addressing constipation
and
is
nuts and
another
seeds,
way to
including
reduce
pumpkin
cancer
seeds,
risk.
are also
Consuming
really
enough
beneficial
water
for
and
gut.
fiber can
Okay,
help
speaking
in
of
this
nuts and
regard,
seeds,
while
there's a
also
common
improving
worry,
intestinal flora.
especially for people who
Other
have,
healthy lifestyle choices that are often overlooked
pouches
include sleeping well,
in the intestine.
exercising,
Diverticula
and increasing social
diverticulitis,
connections,
which is when they get
all of which
inflamed.
have
Right, so the question people
antioxidant
often
and
have is,
anti-inflammatory
is it safe
effects.
for me to eat
Foods
seeds,
like nuts and
the hard
seeds,
bits,
including
if I have
pumpkin
that
seeds,
condition?
are also
It's a very
beneficial for
common
intestinal
question,
health.
and for years the advice was actually
Now let's talk
no,
about
avoid them.
diverticula
But
and
the surprising
diverticulitis.
answer now,
You may
based on
wonder if
good
you can
evidence,
consume
is yes,
seeds, nuts,
you
and the
can eat
hard
them.
outer
Really?
coatings of
That's a
some
big
seeds
change.
and
It
nuts
is.
if you
There
have
was
these
a large,
conditions.
comprehensive study
The
looked at
answer
over
is yes.
47,000 patients.
Contrary
and it
to
found that
popular
eating
belief,
nuts,
a comprehensive
seeds,
study
corn,
involving more than
popcorn.
47,000
It did not
patients
increase
found
the risk
that
of getting
consuming these
diverticulitis
foods
or
does
having
not increase the
complications like
risk of
bleeding.
diverticulitis
So the old
or
advice
its
was wrong.
complications,
It appears
such
so.
as bleeding.
As a result, it's generally
As a
no
result,
longer
it is no longer
recommended
recommended for
patients
patients
with
with diverticulitis to avoid
these
these
foods.
foods.
And actually it goes
On the
further.
contrary,
these foods,
Such foods
being
can
high in
improve
fiber,
intestinal
can actually
flora and
improve your
function,
gut flora,
and may even help
improve
prevent
bowel
colon
function,
cancer.
and may even help prevent
However,
colon
each
cancer
case
in the
should
long
be
run.
individually
Incredible. So nuts and
evaluated,
seeds are
so
back
if you
on the
have any
menu.
intestinal
Generally,
issues,
yes.
consult
But
your doctor.
Very important caveat here.
Colonoscopy.
Every person
What
is
is it,
different.
and who should
Every
get one?
case needs individual evaluation.
A
So if you
colonoscopy
do have
is a
intestinal
medical
issues,
procedure
definitely talk to your
designed for
doctor
the
before
early
making
detection
big
of colon
dietary
cancer.
changes.
Always consult your doctor. Good advice. Okay, so
During
we've
this
covered a lot
procedure,
today. We've really,
a long tube equipped
gone
with a
deep into
camera at its
understanding
tip is
not just the
inserted
steps
into
of
the
colon
intestine
cancer, but
through
this
the anal
huge
region.
role our daily choices
The
play,
camera navigates
both
the
for
entire length of the
prevention
intestine,
and,
searching
spotting
for
things
abnormalities
early.
such as
It seems
polyps,
clear that
tumors,
while,
or
genetics have a
lesions.
part to play.
A
If
small
a polyp
part,
is
relatively
discovered,
speaking.
Right.
it's removed
Our
and sent to a
lifestyle choices,
laboratory
those are the
for
real
analysis
triggers
to
that close
determine
it.
if it's
Absolutely.
benign
and
or
the power
malignant.
in knowing this,
For the
it's about
patient's
agency,
comfort,
isn't it?
the
How much
procedure is
control we
performed
actually
under
have.
sedation or
Understanding
mild
this information
anesthesia,
lets you engage
so most
with your health
patients don't
differently.
experience any
You can ask your
pain.
doctors better questions, make choices that are truly informed, choices that really empower you.
It definitely shifts the perspective, which leads to maybe a final thought for you, the listener, to mull over. How will this new understanding, knowing how much lifestyle matters, how will it reshape those small choices, the seemingly insignificant things you do every day, knowing now they can actually have a really profound impact on your long-term health?